Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode, I answered another question from our readers. And the question last week was how to wean off ECMO. You can check out the answers to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our readers. And the question this week is: my father had a massive heart attack and is now in intensive care, ventilated and in an induced coma. He developed pneumonia and is in kidney failure. What are his chances of recovery? This question from Laura has been part of a one-on-one phone counselling and consulting session with me. Here is an excerpt of the counselling and consulting session. So, Laura writes: Hi Patrick, so my 73-year-old father had a massive heart attack 2 weeks ago after going to the nurse 2 days before, and she sent him home saying nothing was wrong with him even though his blood tests came back as abnormal. He had a stent fitted immediately after he represented back to hospital a few days later and went to hospital as an inpatient. He ended up in intensive care and only had 2 hours to live, but the oxygen helped him and he started to recover, although the tests showed that the whole right side of his heart is completely dead, and in the past 2 weeks it has not healed slightly. He was recovering well until 2 days ago. He became really ill and it turns out he has pneumonia and another infection on top of that they don't know what it is yet. He was rushed into intensive care again, delirious, and he has fluids on his lungs that are hard to get rid of. And this morning he was put into an induced coma as his body was too weak by itself and he hadn't slept for 2 weeks, so he was hallucinating and delirious. It also turns out he has a blood clot in his heart, his lungs collapsed and his kidneys are starting to fail. Of course, from my perspective, he's really close to dying, but is there any chance that he's certain? Will his kidneys and lungs be able to repair themselves if they got rid of the pneumonia? And how easy is pneumonia to treat? If so, how many days would it take before they could wake him from the coma and he could start to breathe better and start recovering? Many thanks from Laura. So, here's my answer. Hi Laura, thank you for sending through your questions and thank you for using my one-on-one phone counselling and consulting service. I'm very sorry to hear what you and your dad are currently going through. You need to know that there is help at hand and that I can help you take control of this situation so that you are in a position to make informed decisions, get peace of mind, power and influence. It's very sad to hear that the nurse misdiagnosed your dad when he first saw her a few weeks back. It looks like the nurse didn't pick up on rather obvious symptoms, and despite the abnormality in the blood results, an ECG of the heart should have been done, as well as it would have most likely shown changes pointing towards the heart attack. It's not overly surprising to me that your dad ended up in intensive care after the heart attack, with the right side of the heart being severely weakened. Usually after a severe heart attack, the heart muscle is irreversibly damaged and therefore a recovery can take a fairly long time. But let's look at what's happened to your dad in detail. With the heart attack and the right side of the heart being so severely damaged, it's only natural that your dad ended up with fluids on the lungs. With fluids on the lungs and the pneumonia. If the right side of the heart isn't working properly because of the severe heart attack, The heart can't pump blood around the body, and therefore it's natural that excess fluids end up in the lungs, causing shortness of breath and pneumonia. With the right side of the heart being decompensated, the lungs are usually the first organ to suffer the consequences of a right side heart attack, usually with fluid overload. This also explains why your dad would have had a blood clot in his heart, again with the heart muscle being so weakened from the heart attack. The heart isn't strong enough to pump blood around, therefore making blood flow more static and causing the blood to clot. Depending on which side of the heart the blood clot was formed, your dad may be at high risk of a stroke. However, the blood clot was more likely to have formed on the right side of the heart, making it less likely to cause a stroke. The heart attack would have also caused severe hypotension, and hypotension stands for low blood pressure, and therefore your dad's kidneys most likely took a hit as well, because they didn't receive adequate blood perfusion due to the low blood pressure. Again, this is what often happens after such significant events like a heart attack. Therefore, it doesn't surprise me that your dad went back into ICU for a second time, this time with ventilation and induced coma. When your dad had the PTCA, the stent to open up clogged arteries to the heart, it might have been too late for damage control, given the delay in diagnosing him properly in the beginning, when the nurse sent him home after he already had sustained a heart attack. When patients suffer a heart attack, timing is of essence, and caregivers usually only have few hours after a heart attack to take the steps that are necessary to control or minimize the damage. You have mentioned that your dad's heart has not healed slightly in the last couple of weeks, and it's unlikely that it will. A heart attack usually irreversibly damages the heart muscle, and therefore a healing is unlikely to occur. Hence, with all of the issues leading up to your dad's second ICU admission, the writing was almost on the wall that he would need mechanical ventilation, a breathing tube, and the induced coma. Again, the heart was getting decompensated after the heart attack, and therefore breathing for your dad was getting more and more difficult due to the fluid accumulation in the lungs and the pneumonia. On his first ICU admission, your dad's condition was not as bad as on his second ICU admission, therefore oxygen might have helped to stabilize him. On his second ICU admission, his lungs had collapsed, his kidneys had failed, and therefore with the kidneys failing, he would have even had more fluids on the lungs due to the inability of the kidneys to excrete urine and offload fluids from the lungs. Again, it's only logical that your dad needed ventilation, the breathing tube, and is now in an induced coma. It's also no surprise to me that your dad now has another source of infection. Hopefully they can locate and categorize the infection and then treat it accordingly with antibiotics. What's next for your dad is to give him time to rest and heal, especially since you have mentioned that your dad hadn't been sleeping for 2 weeks and was hallucinating and delirious. The induced coma and the ventilation will give your dad time to rest and heal. Other things that need to happen in the induced coma are things like giving diuretics, which are medications such as furosemide, Lasix, to increase urine output and offload fluids on the lungs. Also, they need to treat the pneumonia with antibiotics if it's a bacterial pneumonia. If diuretics such as furosemide don't work, start your dad on kidney dialysis as a substitute for physiological kidney function. Also, they need to maintain good vital signs such as a good blood pressure to reperfuse the kidneys with blood. This can be achieved with inotropes such as noradrenaline, adrenaline, milrinone or dobutamine. Also, they need to keep ventilating your dad at least for a few more days to give his lungs a rest, and also pressure to open up the collapsed part of his lungs with the added on extra pressure, which is also called PEEP. The combination of mechanical ventilation, kidney dialysis, the diuretics, the inotropes and the antibiotics should give your dad the best possible option to recover. Please keep in mind that the heart muscles are irreversibly damaged after the heart attack, making a recovery challenging but not impossible. It will take time, and your dad might need cardiac rehabilitation after he will get out of intensive care and the ward. Normally, pneumonia in intensive care can take a few days or a bit longer when critically ill patients are induced into a coma. I've also put a link to an article and a video that will get you started on pneumonia, and the video and the article is "How long is my loved one going to stay in intensive care with pneumonia?" Furthermore, an induced coma can take some time, and here are some articles and videos that will help you understand what to expect in an induced coma, during an induced coma, and after an induced coma. So check out those articles about the induced coma, how long it takes to wake up, how long you can keep a patient in an induced coma, by clicking on the links, again in the written version of this blog below this video. At this stage, Laura, my advice is also to be patient. I know this is easier said than done. However, intensive care is often 2 steps forward and 1 step back, and usually nothing happens fast after a severe heart attack, pneumonia, pulmonary edema, and kidney failure. Try to be as patient as you can. Keep asking the right questions. Asking for professional help, which is what you are doing by using my counselling and consulting service, not giving up, staying positive and believing that your dad will recover, are your biggest assets in this once-in-a-lifetime challenge. I really hope this helps, Laura. I talk to you soon. So, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again in another update next week. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@Intensive Care International phone numbers on our contacts tab. Also check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me over the phone, via Skype or via email by clicking on the Products tab. This is Patrick Hutzel from IntensiveCareHotline.com, and I'll see you again next week in another update.